At Johns Hopkins, we really pride ourselves of serving diverse communities, which really gives us opportunity to reach populations at scale.
Johns Hopkins is right in the center of Baltimore, and so it gets the benefit of taking care of everyone.
Some patients will walk to our hospital. Some patients will drive or take public transportation to the hospital. Some people are flying from long distances to see us.
Even within a city, there are challenges with being able to access care.
Telemedicine has shown its tremendous value to reach patients who have limited mobility, to reach patients that might be older and don't have means of transportation, and to specifically engage patients that may not need to come see us as frequently in person.
Corey is a digital health app that patients engage with.
This is a brainchild of Dr. Marvel. It started with patients that had acute MI in the hospital and her efforts to improve their care and make sure that they had an app to interact with and understand how to take care of their health after a heart attack. And it has now evolved into an interactive patient management tool.
When we think about digital health and when we think about strategies like Corey, the spirit is really around, let's make it easy for patients to engage in how they can better care for their cardiovascular health.
The comprehensive program includes a smartphone application that allows patients to track their health metrics and empowers them to achieve the goals that they set for themselves.
We designed it in a way that's simple, that is goal-focused, and that is really patient-centered, so that ultimately everything that the patient's engaging with Corey, whether it's entering their medication, whether it's looking at their goal for LDL-C so that they know when they're in the safe zone, or they're watching a video that's not too long, short, concise, and really makes the point. We are taking the journey with them with that experience.
When I first was diagnosed with AFib, I felt like, wow, it's just, I'll go to the doctor, I'll tell him my symptoms, he'll give me a pill, and I had very little ownership of it. But it really feels like with this, I have like an ability to record my information, record what's going on with my trends on my heart rate, weight, blood pressure. So when I do meet with a clinician, I feel like I have part ownership of what's happening to me. I'm meeting them sort of halfway, if you will, about coming to it with really specific information.
Well, the app definitely holds you accountable for your medications, and it also gives you reminders for certain medications and doctor's appointments, which is really great. So it keeps you on track as far as reminders of when your medication is due, when your doctor's appointments are due, and also tracking your blood pressure, and your current labs and comparing to the last labs to see how you've made progress.
I do feel like it makes it more personable with the patient, because I can easily access them through many different forums. Like with digital health, you can do email, you can do messaging, phone calls, you can do the app. It's like there's just so many opportunities where you can communicate with a patient.
I think when it comes to building a new innovative technology, the power of multidisciplinary synergy apply. And I think now I realize that in order to move the world forward, we likely need much more interdisciplinary collaboration.
These are all pieces that through the American Heart Association Telehealth Collaborative, we've been able to put those pieces into a roadmap for the patient to follow.
Through this project, we've evolved our telemedicine dashboard to look deeper into specific statistics about these patients, including, are our patients getting appropriate cholesterol medications? And very interestingly, we've evolved the dashboard specifically to be able to look at differences between blood pressure management in those who engage in telemedicine and in those who come into traditional in-office appointments.
We have shown that the virtual intervention is feasible and patients stay engaged in the program for at least 12 weeks, which is a significant time to continue using technology. So now we have ongoing studies where we're going to see whether patients will stay engaged for longer time periods and whether we're going to have impact in significant health outcomes.